to the Ascend Health Show. I'm Nick Angelis. I'm a nurse anesthetist and one of the owners of Ascend Health Center. And I'm here with Jenna. How are you today?
I'm good. How are you?
I'm awesome.
Awesome.
So why don't you tell us a little bit about yourself and then we'll get started with all the great topics we had to talk about.
Okay. So I am a licensed art therapist. Well, not licensed, it's credentialed art therapist. I am a licensed clinical counselor. I work for Carve Your Own Path, which is a nonprofit private practice. I work with two really close friends, Amanda and Lisa, who have been on here before.
They have.
Yes, they just do their things and I just come hang
out. I think this sets
out.
a record because now this is the fourth Carve Your Own Path Ascend Health Center mashup on the show.
So we should put our names there too, yeah?
Yeah, we should.
Yeah, just little
well, actually, sometimes we've had our logo here or your guys' logo here. Then I slowly realized, well, I can take 20 minutes out of my day and try to tape a logo here that will fall down halfway through.
We'll just stick a Post-it.
Oh, yeah.
Yeah.
That would work
It's
really well.
professional.
And especially since you're an art therapist, I'm sure you can take a Post-it note and make it look really pretty.
Sure.
Because that's probably one of our topics is that when we're talking about art and art therapy and expressing your mental health through art, we're not saying that you have to have something that's a Picasso or worthy of a museum.
No.
Since that's sometimes a mental health issue of like,
Yes.
wait, unless it's perfect, why am I doing this?
Yes.
I mean, sadly, I don't have that issue, as evidenced by anyone who's watched the show before. But for some people, they want something to be really good before they'll display it to the public.
Yes.
Again, not this show. Sorry for everybody who thought it was that way.
Yes, absolutely, absolutely. Yeah, no skill required. The less skill, the better, because then you don't get stuck in it.
Okay.
You know? I mean, if you have skill, great, but it's not about the product.
Okay. Well, how did you become an art therapist?
So I was finishing my undergrad at Kent, and I ended up stacking a whole bunch of stuff because I kept jumping around on different things. So I graduated with a a major in sociology and then a double minor in psychology and fine art.
Well, that's fun.
And I was sitting in a printmaking class, and they're like, I don't know what to do next, because to do anything with psychology or sociology, you need a master's.
Right.
Because you can't do anything with it. So I was sitting in a printmaking class, and someone's like, have you ever heard of Ursuline College? They do art therapy. I said, no. Applied the next day. I was like, I don't know what to do. I'm just going to try it and see.
Oh, cool. So your path to being an LPCC was actually starting with the art that you were like...
Kind of. I always liked doing art, but I never felt like I was good at it. So I just started taking classes on the side, and then I ended up adding it into a minor because I had enough. And I really enjoyed it. And then the psychology, I was like, well, I have enough credits. I might as well put it on something. But the sociology was fun because I got to study people.
Right.
And then I was like, I don't know what to do with this.
Right. No, I really
no
enjoy
idea.
sociology too.
Yeah.
But that makes sense. So my brother got me a silk screen kit for Christmas one year, and I was really excited. So I started making him a T-shirt, and then halfway through I was like, oh wait, I'm creative, but I'm terrible at art. I forgot about this. I really struggled in art class.
Yeah.
So no, that makes sense. Okay.
Yeah.
So I was telling you right before we started, there's a comedian, Dustin Nickerson, and I just read his book that said, it was called How to Be Married to Melissa. So it's not that useful. His wife's name is Melissa. So he literally wrote about his own relationship and didn't try to expand it to anybody else.
Perfect.
So it's hysterical. And he said, well, I used to like put down my phone and try to talk to my wife at night because I hadn't seen her all day. And I'd fidget, he has ADHD and probably a few other things. That's why he's a good comedian. And he realized, well, no, if I actually still play Angry Birds, I will talk to my wife and we'll have a great conversation. I'll go deeper. I won't fidget. I will focus.
Yeah.
So is that similar with art where sometimes you can let part of your brain do something and then you can really get into the hard work that you have to do with yourself?
Yeah. Yeah, so it's kind of twofold. So you can do it that way where it's like, if I'm focused on something, then I'm not going through like the mind thing of like, am I saying this right? Am I doing this right? I'm like really, really in it, kind of focused on it. Whereas I can just kind of create something and it becomes just like passive, like hang out with a friend communication of like, oh yeah, this is going on and this has happened. But your main focus is on the art. And then on the other side of it, the good thing about the art therapy is that if you don't have the words, it's too difficult or you can't find the words because we very much like to label things and put it precise.
Right.
You can use the art and then work through it and figure out, okay, this is kind of what maybe this would mean, and let's talk about the art rather than you.
That makes sense.
Even though it's connected.
And this is confusing to people who've watched this show before. And should probably put out those caveats, this is a show you're going to watch on the internet. Don't base all of your mental and physical health on it, blah, blah, blah. There's actually an episode called Don't Put Your Toaster in the Bathtub, where it's just like 5 minutes of me talking about like medical disclaimers. So you should just reference that rather than saying every show.
Yeah.
But it is similar to that, where for whatever reason, I get experts on the show, and most of what we say is, hey kids, here's what you can do at home, instead of, oh, you really need to come to our office. You've got some serious issues that require a copay to solve.
Right.
But I mean, that's the whole point, that there's so much that we can do by ourselves. We can certainly start the process, and then if we have a hiccup, then it's time to find a professional. And I think you're saying that art's part of that. Just like you have a counseling session, you're hoping at the end of the hour you have some realization or some expression of, oh, this is why I'm this way, or this is how I really feel. So you're saying you can do the same with art, that I don't know the words, but hey, it's on the paper, and now people can understand it a little better.
I keep it as layman terms as possible. I can get into so many different things of what I had to go through to get my degree, but it's literally just, I'm the professional, yes, but you're the professional of your life. So you just need to show me what's going on, and then I'm going to help you figure it out. And that's usually what I tell people.
That makes a lot of sense. Like when I was a new nurse back in 2004, one of the first things I learned was, okay, you can have all the ideas for someone with diabetes. Like here's a scale, here's how much insulin I need to give you, here's what you need to eat. But if somebody with diabetes is in the hospital and they're saying, no, that's too much insulin for me, or no, this is how my body works, you need to listen to them or you're going to make a terrible mistake.
Absolutely.
Like we are the experts of ourselves.
Absolutely.
So it's really fun. And it also sounds that, is it almost what you said about the two ways to do it? One, you're focusing on the art, and the other one, the art is just like doodling while you're thinking. Is that related to the skill too? Because again, someone like me who's not good at art, it might be better to be the passive part of it.
Yeah. There's always this idea, especially with the ADHD, of like, I need something to be repetitive or something to be moving to kind of just not be overly focused or like trying too hard. Because you think about it, especially with like ADHD, it's like, okay, I have to focus. I have to focus. And now you're just thinking about, I need to focus, I need to focus, I need to focus. What are you talking about? And it's like, it just kind of gives you something to kind of mindfully do. Art definitely is a relaxer, a de-stressor. Just kind of that movement, getting back in your body. It doesn't even have to be anything huge. It just gets you back in there, just kind of be like, all right, I'm here.
No, that makes sense. I teach a Sunday school class for 4th and 5th graders, and I realized, well, if there's a kid with high functioning autism or with ADHD, he or she can learn, or they can sit still, but they're not going to do both. So you have to determine what's fair for all the other kids, because I'm certainly not going to make different rules for each kid. And yet, like, what gets the message across, or what's the actual purpose? So I think you're saying for art it's the same thing, where what is the actual purpose of what we're doing? And it's not necessarily just to like waste a bunch of colored pencils.
Right.
Although that's fine too.
It is. Yeah, I had actually a client yesterday that I was like, you know what? Let's hang out. We're just going to color, kind of get to know each other a little bit, see what's going on, and just kind of make this space comfortable, you know, and then, you know, we have conversation that comes out, but it's not like, okay, this is what your thing says to me. Let me go through all of the stuff that I've learned. It was just, that's a really awesome cat. Like,
so you're also kind of reassuring people that they can come to you, do art therapy, but it's not going to be this like, well, let's see what this really means about your, which is good, because I would doodle during class, even in graduate school. And looking back, I was like, I like drew some pretty dark stuff. You know, had I been a kid in today's generation, I'm sure I would have had to visit the school counselor about it.
Probably.
And I didn't necessarily have any sort of psychosis. I was just a weird kid, much like I'm a weird adult today. But I had someone like really focus on figuring this out. Well, I take that back. I did have an 8th grade teacher, I went to a small Christian school, who gave me a book about satanic rock groups. But since I didn't listen to any music at the time, it was kind of irrelevant. I mean, I learned a lot that maybe I shouldn't have learned at that age, but still.
Maybe, yeah.
So you're saying, look, let's express yourselves. It doesn't have to be, it just is what you feel at the moment.
Yeah, I mean, the whole point of having the art therapy credential is to like break it down. And things as intricate as you put something that faces the left side of the paper in the upper corner, and like there's psychology behind it that they're still learning, because a lot of it's based off of like 20, 30 years ago. I mean, art therapy really only started out here in 1940. So it's still very new, which is why a lot of people don't know about it, which is why it's not covered by a lot of stuff. Like when I do it, I have to do it under counseling. I can't just be like, art therapy.
Right.
There's limitations, but most of the time it's like, yes, I can go into that stuff, but let's see where the expression is first. And then I can pull in some of that stuff, and then I know, like, okay, you face to the right, you're thinking about your past kind of thing. That's just kind of like psychological, like, stuff that happens. So let me focus on that. And just kind of steering it without being like, you drew a black circle. What is ruining your life? Because it might not be that at all.
So you're saying, like, if there's some sort of block, then it can be useful to kind of, and I mean, we're kind of the same way at Ascend Health Center, where with the TMS and the ketamine, a lot of times that can reveal, okay, we've hit a roadblock with medications, we've hit a roadblock with therapy, or sometimes even with pain management. Let's see if this will unlock it. And then it's up to, us as professionals and the patient to decide, okay, this is unblocked, now you can go back to the avocado toast and eating right and some therapy, or no, this is something where you have to have ongoing medical care for this. So, okay.
Absolutely.
And then what is the relationship between depression and creativity? Because, we're used to, I think in the 1800s, it was more that you just have like typhoid or some sort of disease, like the starving waif of an artist. But it's still understood that a lot of times people who are very creative also suffer from, because they're so sensitive to emotions and so sensitive to things, they could also suffer from some mood disorders or whatnot.
Possibly. I mean, there are definitely studies that I've come across that are like, if you're more depressed, you are more creative. You can't really back that. It's a possibility, but it's more about potentially these people find a different way to express. It's like, I can't talk about it. It's too hard to talk about, or I don't know, or I don't have people that are going to listen, so let me put it somewhere else. Kind of like journaling or like Dear Diary or something like that. It's like, it's a way for me to get it out. Or, some people, they make art and stuff that tells a story. And it's like, I can't really put it in, so I'm going to put myself in here and let that character do the story. So it could very much be that of just a different way. Because you can't really articulate and explain depression the same way every time. Everything is different.
And I think that is our main point today, is that you can use art, you can use journaling. There are ways to get what's in your head out, whether it's on paper or whatnot. And at that point, you have a better sense of what help do I need, because that can be a real challenge. Like, okay, do I need, the way our culture pathologizes every negative emotion, you can easily find your way to all sorts of diagnoses just because you're on a search. And sometimes a better way is, well, let me write some stuff out, let me express myself, and then we'll have a better sense of what's going on in my head. Is it normal? Is it pathological? Does somebody else need to address this, or am I fine? Because it sounds, again, us being health professionals, that we would say, oh, we've got all these diagnoses, but for sure, and there's an advantage of at you guys with Carve Your Own Path, where because you're self-pay, it's not this, okay, give us your copay, here's your diagnosis, insurance will pay for it. It can be more of an exploratory, like, well, let's see if this is something we need to deal with, or if this is just who you are as a person, and that's all there is to it.
I love not being able, I love being able to not be like, okay, it's 50 minutes, here's your diagnosis. We're going to figure out if that's really what it is, but I need to do it for insurance. Like, I really enjoy being like, okay, let's just flush this out. If there is one, of course, I'm going to, provide that for you, give you the education, give you the right tools, how to get there, whatever else you need, referral-wise. But otherwise, I don't have then to be like, okay, we've gone through this assessment. What can I pin on you right now? So I very much enjoy that.
Well, especially for us, because we specialize in treatment-resistant depression, it means that people come to us with all sorts of labels. Like, at least somebody is gonna say that they're bipolar, like 2 or 3 other things just on the side. So it ends up with this like strange tossed salad of diagnoses.
Yes. And actually figuring out what's going on.
Right. And and I think through art too, it helps people realize, okay, what is the big issue of my life? Because like, oh, I can't pay attention, but I'm also sad, but this also makes me anxious. Sometimes you do have to pick one. And that does allow, like, okay, what seems to be coming out in my artwork is this. So apparently this is what, my inner mind or my real self wants to deal with.
Yes, absolutely.
Because unfortunately, again, for people who've seen this show before, the idea of like getting down to the root, really knowing yourself, these are recurring themes of that. Until you kind of know what you need and what's going on, you're going to see a lot of doctors, a lot of therapists, pay a lot of copays, and a lot of times you're no better for it. Now, obviously, we're here saying, oh, no, we're great professionals, we can help you. But it's true. Like, anyone that you talk to is going to say, yeah, we can really help you. But sometimes it's like, I can do this myself. And it's hard to figure that out until you get a better sense of what's actually going on inside of me, what really matters, and what sort of facades because and I know this is more of a PTSD theory, but often our brains will tell us, oh, here's the issue, just because they don't want to really focus on what's really going on. And until you do that, well, then you're going to end up seeing a lot of doctors and therapists.
Absolutely. Yep.
So is there any way that we shouldn't be creative? So when I was growing up in the 90s, there was a lot about straight edge bands who they didn't use alcohol and drugs to come up with their creativity. So where are the limits? And this is also a relevant question because, you know, I operate a ketamine clinic. So we have plenty of patients who, after undergoing the experience of a psychedelic kind of mind shift, they are creative where they weren't before. They can start. Our office has a mural by a patient who was not creative until after they got some of this depression lifted from them using ketamine, and then they drew this beautiful mural. But we're not at all saying, oh, you should do drugs, then you'll feel better, and you'll be so creative.
Yeah. I mean, I know that there's a lot of studies coming through about the psychedelic medications. I don't know enough about it to be like, this is accurate or not. You kind of have more of an insight than I do.
And it's a very nebulous topic too.
Yeah,
so
it's
very person specific.
In the way that I kind of look at it is, just like you would say, it's all about kind of the intention and how you're using it and what it's for. So if you're just like, this is the only way I can be creative, you're actually creating out of a mask. Because all it is I'm going to put this substance on or something, and I'm going to create through that substance. But it's not fully you. You know, where like the ketamine treatments and stuff, like you're working towards something, figuring it out. There's like different levels and things to kind of get to a point of healing or for lack of a better word, fixing whatever's going on, where that is just like, okay, I'm gonna put this on, I'm gonna do this, and then once it runs out, my creativity's gone, kind of thing. So it's definitely something that can be used to tap into stuff, but the purpose is to find out how I can tap into what I already have.
Sure. So you're saying that otherwise it ends up being the person who's like, well, once I have this beer, I can be social. Once I have a glass of wine, then I can relax.
Yeah.
So it can be the same thing.
Yeah. It definitely helps because it lowers the inhibitions, but maybe it's not about focusing on I need the beer to be social. It's about figuring out, okay, what is holding me back from being social?
Right.
And how can I do that without only needing the beer?
And it becomes challenging because, well, what if you're on psychiatric medications? Like you need to take those every day, and without them, you can't be what you need to be. So it becomes a confusing issue.
Absolutely.
At the same time, I firmly believe, again, we have a psychiatrist, nurse practitioners. Most of Ascend Health Center is, here's your psychiatric drugs. But, and it's completely necessary for many people. But if there are ways where you need something rarely and then it takes care of the issue, that works so much better. For example, medicinal marijuana, which I was all about when I started this clinic. And I'm like, how different is it really from alcohol? Because while it's in your system, it works, it helps your anxiety, pain, whatever. But then once it's gone, you need more of it. So it's that same thing of, okay, what's a crutch? What's absolutely necessary and you shouldn't feel guilty about it. And again, these are case-to-case bases.
Right. And that's kind of the same, like I get in those conversations a lot with medications too. It's like, well, what's different for me using this earth-based natural thing versus the medication? And it's the same thing. It's like, yes, there is a point to it, and like we don't provide medications, but we talk about it, and it's like, I will give you as much as I can to meet that, because you may need it, but it's more about I don't want to focus on it that this is the only thing that makes me okay. It's what can I kind of ebb and flow to say, well, this is what I'm doing for me, and then this is what needs to come in. It's like, usually most of the time, the only way that I can explain it is like chemo, right? You need that type of drug for a certain point for assistance, but what else can we do, you know, in that sense?
Well, that's a good point. A lot of times the way I explain it to patients is, okay, here's what you can do for yourself. If you don't do that, we'll still treat you, but you'll be our patient forever. If you do that, then we can use these treatments as a springboard, and then you can continue to need less and less, or fewer professionals. And sometimes it is a money decision. Like, okay, this is how much your insurance denied this medicine. We might as well look at some lifestyle changes, because otherwise you're going to be paying a lot for it.
Absolutely.
And I think it's wise to look at mental health that practically, because sometimes there is a shame component. There is a I must earn my health component. I was caught up in that for years, where I need to take this supplement, I need to eat this way, and if it all works out, I've earned my health and I can go forward, which wasn't really that great for my mental health, as you can imagine. So that might be an example of an activity that could be bad for your mental health, where you're healthy, but you have a mindset of, okay, I've earned it. Now I've done the work, and look at these people who aren't doing the work.
Yeah. That comparison, right? Yeah, and also, I mean, I talk about this a lot with my clients, is that it also depends on the type of personality person you are. So like they're always like, oh, you need to get out, you need to be with people, you need to be there. But if you're more of an introverted person, you're losing more of your energy. So it's like, how much do I need to be out? How much do I need to be in? And then opposite, you know, if I'm an extroverted person, I get a lot of energy from there, but am I putting everything on those people? I also need to know about me.
Yeah, I've seen so many articles on how to be more outgoing, how to make friends. I've never seen any of like, how about you shut up, stay inside, and read a book for once?
Yeah, and it's knowing the difference between I am more introverted and I need some time to recoup by myself, and I'm isolating. You know, and it's like learning the differences between that. Like, what is your intention of staying in? Is it because this is a part of who you are and you're comfortable with that, or are you, I need to stay away from people, I'm avoiding, like, get away from me kind of thing?
Well, that makes sense. I usually view it as, who are the people in my life that I'd either help move or take to the airport? So whether we're introverts or extroverts, we all need somebody close enough that that's something that we would do for each other. And especially with what we're talking about, creativity, finding limits of what do I need, I think we all, and obviously professionally a therapist would do this, but even without a therapist, we all need people in our lives who can be like, you know, you've changed because of this medication and I don't think it's for the better.
Yes.
Or, you know, I think you do need to be more creative, or sometimes even like you just need to get off your butt. So, and again, that's challenging because therapy is supposed to be this self-affirming type of treatment, but at the same time, sometimes it is like, no, you just need to draw. That's what you need to do right now.
Yeah, and that's completely fine. Yeah, just draw. It's all right. You don't need to change the world. You don't need to get up and do like these huge things. Just let it out.
And I assume that's basically your advice for someone who wants to know more about art therapy, like start by just drawing something.
Yeah,
is it any more complicated than that? Or?
No, a lot of times I'll just have people, like we've had things like beginning art therapy stuff and things that you could do on your own. It's just like scribble, draw, like see what comes out, take a couple minutes and just kind of check in with yourself. Like in the beginning, how anxious or how kind of tense am I feeling? Do that for a few minutes at a time, or 5-10 minutes if you want. How am I feeling now? It's not going to make everything perfect and better, but you might notice a little bit of like, okay, I got some of it out of the way. Like I just got into my body, and that's a lot of it. And Carve Your Own Path talks about that all the time, especially Amanda. Get out of your head, right? We float around in our heads rather than being back in our body where everything really is.
Right.
And we're too busy thinking and solving and trying to make, you know, connections instead of just letting us be.
We do that. So the Spravato, it's a nasal spray, ketamine, and we'll provide adult coloring books because we had some patients who were like, I need to get better. Let me focus on the neurogenesis and the synapse. And we're like, listen, why don't you just draw a little bit? You'll be fine. And that slight, like we brought up at the beginning of this conversation, that slight, okay, let my brain focus on this and also on this, let it relax. Similar to how a lot of times you can have really good conversations with people while they're driving because part of their brain is making sure, so maybe not too deep of a conversation depending on how good of a driver they are. But again, that slight inattention actually allows us to open up a little bit more.
Yeah, and even in counseling, sometimes it's like if something's too difficult to talk about, go for a walk. Like there's walking therapy of just like, we're gonna walk, you're doing something, you're kind of fidgeting because you're moving, but it kind of frees up a little bit of that energy to be like, okay, let's talk without me staring at you and saying, tell me your deepest, darkest secrets. Absolutely.
Most of the biggest decisions in my life of the last 5 to 10 years were made on a single path in a national park in Florida. I was like, yep, this is the part where I decide this is the part where I decide that. So absolutely. So if someone wants to know more about art therapy or they want to attend an art therapy class, what's their next step? I guess I could just get on your website.
Yeah, I was like, let me think if there's anything going on right now. I mean, so you can Google art therapy, right? It depends on what you're going to get. So like we very much, because it is a credentialed thing that's not licensed, we're very protective over the term art therapy. So you can only get art therapy for someone who's credentialed. So they have an ATR, an ATRBC, things like that. But you can do art as therapy. So like Pinterest has a whole bunch of stuff. Like I'll even go on there and be like, I can modify that to be a little kind of art-based, but it's really about start with expression. Find something that you enjoy. It can be drawing, it can be painting, it could be crochet, it could be sculpting, origami. I've done with people. Just start expressing and just getting back into that mindset of just, I can do things.
Absolutely.
Yeah.
Yeah, the act of creating.
Mm-hmm. Yep. And then, I mean, we have carveyourownpath.org, carvemypath.org. We have, I wrote it down because I'm going to forget. So let me
that's
look.
fine. You guys are doing so many things that you probably need to.
I know. I'm like, what am I doing? So creativity wise, if it's something that you want to look into in the next few days, I am doing an envelope journal. Literally just taking envelopes, creating a journal that you can express and put things in and just start that process. Like, you have something that you've created. It's not just like, I'm going to buy this journal and I'm going to write in it. You're going to make it your own from the beginning.
Awesome.
You know, so we do that. We do wellness panels, talk about art. What else do we have going on? Yoga and Reiki. I mean, it's not art based, but it's expression.
Still expression, still movement. Still, is there some way to get better without having to take antidepressants?
Absolutely.
So,
absolutely.
and we are neighbors because you're in Copley. We're on the Fairlawn-Copley border by Copley High School. And for us at Ascend Health Center, we do specialize in treatment-resistant depression. So it's transcranial magnetic stimulation, Spravato, ketamine. But again, what we're trying to tell you today is maybe you don't need the new shiny thing. Maybe what you need to do is start expressing, and you'll have a better sense of what you really need. So we can help you with that. Obviously, you can help people with that, and it all starts with a phone call or getting on a website and seeing what makes sense to you. I mean, that's the other advantage of this show. People get to see our personalities and be like, oh, I'm interested, or like, nope, not my people. And that's great. Saves everybody a lot of time.
And then we stay on our socials, CYOP Inc., because we're going through a rebrand. So CYOP Inc. is where we're moving now. Carve My Path is the website until we switch it over, but all of our socials are on there. We have little things that, you know, here's information, here's what we have going on, little tidbits, little stuff to be like, let's boost your day a little. But yeah.
Awesome.
Absolutely.
Well, thanks for being on the show, Jenna.
Yeah.
And you've been watching the Ascend Health Show.
You are watching WCTV, Wadsworth Community Television.